Hi, my name is Olivia McQuarrie, and I'm a rising senior at Clemson University. I am a double major in political science and women's leadership. This summer, I had the privilege of working with Professor Jake Jensen on his project entitled Tracking Unintended Effects of Communication and Behaviors Related to COVID-19. First, I'll give you a little bit of an overview into the project as a whole before I get into the specific areas that I helped with. So the goal overall for this project was to analyze public response to pandemic communication over time. The model of this experiment was to track 4 different perceptions of communications over an 18-week period of time. These 4 perceptions are exhaustion, overload, repetitiveness, and exaggeration. This was a repeated and cross-sectional experiment with 400 people surveyed each week, with the exception of 1,200 people surveyed in week 1. So week 18 of the project has actually already been completed, and that was the week of July 10th through 14th. In my presentation specifically, however, I will be showing you the data from the first 9 weeks, which is the week of March 13th through the week of May 8th. These are preliminary findings that have been analyzed. So the first perception of communication that we're going to look at today is exaggeration. So here's a graph that dictates the percentage of U.S. adults who feel that COVID messages are exaggerated. As you can see here, initially in week 1, it is 52%, and then towards week 3, you can see there's actually a drop in the numbers, and it's around 34%. In week 6, the numbers start to increase again, with 37% of U.S. adults feeling that COVID messages were being exaggerated, and then in week 9, we're back at 40% of adults in the United States feeling that these messages were exaggerated. The next perception of communication that we're going to look at is repetitiveness. So this graph here demonstrates the percentage of U.S. adults who feel that COVID messages are repetitive. In week 1, 51% of U.S. adults felt that COVID messages were repetitive. So it's almost 60%. There's a drop in the numbers in week 2 to 51%, and then as you can see, the numbers kind of hovered around that 49 to 52% kind of area. And then in week 8, it started to rise again to 56%. Week 9 rose above the week 1 numbers to 60%. The third perception of communication that we looked at was overload. So this graph demonstrates the percentage of U.S. adults who felt overloaded by COVID-19 messages. The numbers fluctuated a bit in the first 3 weeks, starting around 46% felt overloaded by COVID-19 messaging. And this number started to stabilize in week 4 as 51% felt overloaded, and then stayed consistent at 50 until it fluctuated again here in week 8 at 45%. At week 9, it was 53%, demonstrating that weeks 2 and weeks 9 were the high points for feeling overloaded with information. The fourth and final perception of communication that we looked at was exhaustion. So in the beginning of week 1, 51% of U.S. adults said that they were exhausted by all of the COVID-19 messaging. It seems to fluctuate a little bit in the first 3 weeks, and then it stabilized starting around week 4. It fluctuated again towards week 8, and then the numbers show that week 2 and week 9 were high points in adults feeling exhausted by these COVID-19 messages. So that was kind of a look at the project as a whole. Now I'm going to get into the area that I helped with the most. So the bulk of my involvement in this project was in the time shift experiment. And the goal of this experiment was to answer the question, how can messages cut through feelings of overload and exhaustion? This is basically a message experiment to test how narratives from the 1918 and 1919 influenza pandemic could affect intentions to follow social distancing behaviors. So this particular experiment was conducted during week 14, which was from June 12th through June 16th. The sample included 417 participants. The average age of these participants was 46.53 years old. 82% of the participants were Caucasian, 51% were female, and 49.9% had a high school education or less. So basically 3 versions of 2 different stories from the 1918 and 1919 pandemic were created. I wrote the stories by selecting narrative from the CDC's website, and they have a series there called I Survived, and it's a section of their pandemic influenza storybook. So I took these narratives that were written by various people who had lived through the pandemic or had a family member who lived through the pandemic in 1918 and 1919, and then used these narratives to create a story for this experiment. So I ended up writing 3 stories total, but 2 ended up being used, and then within those 2 stories, 3 different versions of each story were created. Participants were randomly assigned one version of one of the stories to read. So version 1 established that it was a 1919 pandemic story at the start of the story, which we called a beginning reveal. Version 2 established that it was an 1919 pandemic story at the end of the story, which we called a end reveal. And then version 3 established that it was an 1919 pandemic story at the survey completion, at the end of reading and participating. So we called that no reveal. So here's an example of one of the stories that I had written. And here you have the 3 different versions of which the story was written for this experiment. This story was taken from a story about Clifton and Nellie Taliaferro on the CDC's website, and this story was told by Linda Palmer, who is the granddaughter of Clifton and Nellie. So in this story, and in the other one I wrote as well, they were written in third person, and I based it around the events that were explained in the particular narrative. I included the main character or someone close to the character becoming sick. So in this particular case, Nellie and Clifton were the ones following social distancing guidelines in the narrative, and Nellie's sister, Alice, who is a hypothetical made-up character, was not following the social distancing guidelines, and ultimately, due to her behavior, contracted the virus. So when I was writing these stories, the goal was also to write it in a way that it could be applied to the current pandemic that we're experiencing with COVID-19 and the 1919 pandemic. So until we added the reveal of when the story took place, you wouldn't be able to tell which pandemic the story was focusing on. So in these 3 narratives I've shown on the screen, you can see in the first column, the box highlights the beginning reveal. Nellie and her husband Clifton were living in Washington, D.C. when the 1918 influenza pandemic struck. Here in the second column, you can see that I highlight the end reveal. No one in Nellie's household became ill. It was the 1918 influenza pandemic. The pandemic continued in waves into 1919. And then finally, in the third column, there's no box highlighting any sort of portion of the text because there is no reveal in this case. So what was found in this experiment? The first finding pertained to the feeling of surprise. Beginning and end reveals compared to no reveals showed that the 1918 and 1919 pandemic stories created surprise. The higher the surprise, the higher the intentions of social distancing. Therefore, it can be concluded that the 1918 and 1919 pandemic stories indirectly affected social distancing intentions through surprise. Similarly, the second finding pertained to the feeling of hope. Beginning and end reveals, when compared to no reveals, showed that 1918 and 1919 pandemic stories created more hope. As with surprise, the higher the hope, the higher the intentions to social distance. Therefore, in this instance, it can be concluded that the 1918 and 1919 pandemic stories indirectly affected social distancing intentions through hope. So what is the ultimate answer to this question? How can messages cut through overload and exhaustion? The answer seems to be the messages that can cut through overload and exhaustion do so if they invoke emotion. So the 1918-1919 pandemic stories generated the emotions of surprise and hope. These emotions helped to persuade audiences to follow social distancing behaviors. Overall, I very much enjoyed my time helping Professor Jensen with this project, and the findings have been very interesting. I can't wait to see the final results as well as the resulting publication that will be produced at the end of this quarantine period of time. Thank you so much.